Imagine living in a time where medical science was less about microscopes and more about trial and terror. A time before antiseptics, anesthesia, or even the most basic understanding of germs, when our ancestors had to rely on the limited tools and knowledge of their era. Surgery today might feel frightening, but it pales in comparison to the terrifying practices of our medical past, one of which might be the most shocking of them all: trepanation, the ancient practice of drilling a hole in the skull. Yes, you heard that right. More than 7,000 years ago, humans performed one of the first known surgical procedures, using primitive tools to bore holes directly into the human skull. Now, why would anyone willingly have their skulls drilled? It wasn't for decoration or some macabre fashion trend. Ancient healers believed trepanation could cure a wide array of ailments, from migraines and epilepsy to mental health issues and even head injuries. By drilling into the skull, they thought they could release spirits, demons, or any imbalance causing sickness. It wasn't just pseudoscience. It's as if science itself took a detour down a horror story lane. But let's paint the full, chilling picture. No advanced technology, no sterilized operating room. Trepanation tools were as crude as they come: sharpened stones, bone chisels, or sometimes even flint knives. Imagine lying on a wooden slab, no anesthesia to numb the brain-rattling agony. Rather than sterile conditions, the ground was likely dirt, and the surgeon was more healer than expert. What now seems unthinkable was considered a form of hope back then. The shocking part? Trepanation was remarkably widespread. Archaeologists have unearthed remains from South America to Africa to Europe that show signs of these surgical attempts. In fact, some skulls have evidence of multiple trepanation procedures, revealing that the patients not only survived the operations, but also went back for seconds or thirds. And here's where you might raise an eyebrow. The survival rate was higher than you'd assume. Some studies of ancient skulls show healing around the edges of the holes, indicating that ancient trepanners weren't as reckless as it seems at first glance. Still, the thought of waking up one morning and deciding, you know what might solve my headache? A hole in my skull, is both baffling and unsettling. Let's fast forward hundreds of years. Trepanation didn't stay locked in the dusty past. It somehow crept into more modern eras. During the Middle Ages, for instance, European physicians still performed trepanation, this time paired with some of the most bizarre medical theories. They claimed it could balance the humors, the bodily fluids at the heart of medieval medicine. Blood, bile, phlegm. They believed these liquids needed to be perfectly balanced for good health. Have a headache? Clearly an excess of humor. And out came the skull-boring tools. But it gets worse with time before it gets better. Some resurgence of trepanation even occurred in the 20th century, pushed by proponents who made surreal claims, from enhancing consciousness to achieving natural highs. Yes, they were outright believers that a hole in the skull could elevate the human mind and connect us closer to cosmic understanding. These followers took a horrifying medical history and brought it into the world of pseudoscience once again, proving that even outdated and creepy practices can somehow linger. So here's the question. Did trepanation ever really work? Modern-day science gives a resounding no. The brain's meninges, a protective layer, help keep pathogens out even after trepanation. Back in ancient times, while some patients indeed survived, many others succumbed to infections or complications. And while the placebo effect might have tricked some into feeling temporarily better, modern medical knowledge shows just how disconnected this practice was from actual health benefits. And yet, the eerie legacy of trepanation remains a fascinating study, and a grim reminder of just how creative and desperate humanity has been in the quest to understand and heal the body. It serves as a token of how far we've come in the fields of medicine and science, but also a warning of how superstition and incomplete knowledge can lead us down dark, twisted paths. So, next time you feel frustrated about going to the doctor or facing a complicated medical procedure, just imagine living in a time when the solution for a migraine might have been having someone drill through your skull with a rock. And that's just one of history's creepy medical stories. Imagine yourself in an era where the walls of medical knowledge were painted with myths and wild theories. A time when desperation pushed the boundaries of reason. Welcome to the 16th century, where one glittering element promised almost magical healing powers. But behind the shimmering curtain, it was anything but a miracle. Let me take you on the unnerving journey of mercury in medicine, a story where hope and poison walked hand in hand. Yes, mercury, the liquid metal known today as incredibly toxic. But during the Renaissance and even centuries beyond, mercury was considered a potential cure-all. Open any medical manuscript of the time, and amidst remedies that involved ground-up gems or mystical herbs, you'd find mercury proudly occupying a central spot in the apothecary's arsenal. And why not? It seemed exotic, almost alien, a true gift from the universe. But the truth? Oh, friend, it would become one of the deadliest mistakes in medical history. Let's rewind. By the 15th and 16th centuries, syphilis, a disease we now treat with antibiotics, was wreaking havoc across Europe. It was known as the Great Pox, consuming its victims with sores, rashes, and bone pain. Enter mercury, hailed as a mystical antidote. Physicians prescribed it in all sorts of insidious ways. Ointments rubbed directly onto the skin, pills meant to be swallowed, and in some cases, by inhaling mercury vapor. Imagine being sick and told to sit by a boiling pot of toxic fumes, your doctor cheerfully reassuring you that relief would soon follow. And to the patient, it sometimes felt like it worked, for a while. Mercury could temporarily suppress some symptoms of syphilis, but at a horrifying cost. As the treatment continued, the dangers reared their ugly heads. Patients began losing their teeth, experiencing uncontrollable body tremors, and suffering devastating neurological damage. Their hair would fall out, skin would peel, and some would suffer from madness, a condition we now recognize as mercury poisoning. Gruesomely, their bodies broke apart trying to heal what mercury mercilessly destroyed. Yet deluded by transient relief, the belief in mercury as a cure persisted for centuries. Now, brace yourself. This next part is where it gets even darker. Mercury wasn't just associated with syphilis treatment. Physicians suggested using it for everything from intestinal worms to depression. In China and India, alchemists believed the element could grant longevity. In medieval Europe, it was even considered in the pursuit of an elixir of immortality. Turning to mercury wasn't just a desperate measure. It was woven deep into cultural practices that blindly tethered trust to alchemy. And who were these early adopters of mercury poisoning? Let's paint a scene. Nobles battling court intrigue, adventurers returning from distant lands, or even desperate peasants, all grasping at the smallest thread of hope. Imagine the palatial rooms of royal families or the darkened chambers of commoners, mercury ointments glinting faintly by candlelight. Each compound brought not healing, but a slow, secret torture to its user. One famous victim? Queen Elizabeth I. History whispers that a mercury-laden cosmetic, once applied to smooth her smallpox-scarred skin, likely led to her frail state in her later years. And Elizabeth wasn't alone. Mercury quietly wove through society's pursuit of beauty and health, poisoning patients and practitioners alike. The 19th century saw humanity's eventual break from this toxic romance. Science caught up with desperation, revealing mercury's true nature as an insidious killer. By then, however, the damage had long been done. Thousands, if not millions, died from what they believed was life-saving treatment. Ironically, the very hands of the healers often became harbingers of suffering. And yet, the story of mercury in medicine isn't fully closed. Today, trace amounts are still used in some vaccines for preservation, although closely monitored and subjected to rigorous safety standards. We've learned from history, but not fully left it behind. So, my curious friend, as you marinate in this tale of trust gone wrong, remember, medicine's history is as much a story of progress as it is a cautionary tale. And mercury? It's not just a relic, it's a chilling reminder. What are we doing now that future generations might see as equally horrifying? And that's just one of history's creepy medical stories. Imagine lying unconscious, teetering on the brink of life and death, and suddenly someone decides the best way to revive you is by blowing smoke. Yes, cigarette smoke, into your rectum. Sounds absurd, doesn't it? But once upon a time, this bizarre practice was hailed as a genuine medical revival technique. Ladies and gentlemen, welcome to a chilling chapter of Dirty History Doctors. In the late 1700s and early 1800s, medicine wasn't exactly the science we know today. Physicians often relied more on superstition and experimentation than actual evidence. And this was one of their strangest experiments. The tobacco smoke enema. Its story begins with one of the most unpredictable and devastating aspects of life by the water: drowning. Back then, people drowning in rivers or seas were almost always thought to be beyond hope. But as medical and anatomical knowledge expanded, albeit minimally, some believed there was a chance these souls could be revived. Enter the medical revival kits, many of which featured a peculiar instrument, the tobacco smoke enema device, a small bellows, much like a bicycle pump, attached to a tube for delivering smoke directly into the rectum. So why tobacco? During the 1700s, tobacco was seen as a plant of mysterious medicinal properties. It was associated with stimulating respiration, inhaling life, so to speak. Physicians thought blowing tobacco smoke into someone's intestines would stimulate the body to come back to life. It was supposed to generate heat, spark circulation, warm cold and waterlogged bodies, and even expel what they called harmful vapors. But let's take a closer look at the people who used these devices. The movement was championed particularly in England, supported by the Humane Society of London, which promoted life-saving measures for drowning victims. Imagine riverside responders racing to the scene of an accident, not with CPR knowledge or defibrillators, but with bellows, tobacco leaves, and the belief that this unusual method would bring someone back from the icy grips of drink. Victims were laid on their sides as soot-filled smoke blazed hot into their intestines. As disturbing as this may sound, it was undertaken with utmost seriousness. Tobacco enemas became a prominent symbol of medical innovation from as early as the 1770s. And here's where it gets even stranger. These kits weren't just reserved for trained physicians, they were hung up in public places. Imagine, by the Thames River, enema kits were available for the general public to use in case of emergencies. Anyone daring enough could simply walk up to the scene and think, "I'll save this person," pick up the bellows, stuff the tube where it needed to go, and proceed to blast tobacco smoke into the victim. Talk about a DIY revival scene none of us would want to witness. Now, while the concept may seem absolutely bonkers today, there were a few minor successes. Some hypothermic drowning victims exposed to this method did gasp and revive. Of course, modern science tells us this might have had more to do with positioning or incidental warming of the body than the fumes of the tobacco itself. Nevertheless, tobacco smoke enemas gained an unsettling place in medical history. But this trend didn't last forever. By the early 19th century, scientists began to better understand how harmful smoke and tobacco could actually be. The practice of the tobacco smoke enema was phased out as more effective and less invasive techniques improved resuscitation methods. And interestingly, as history has played out, tobacco went from being revered as a medicinal wonder to becoming one of the deadliest additives worldwide. So, the next time someone jokes about being unable to blow smoke in your direction, remember this eerie truth about medicine's darker days. Who would have thought that for close to a century, smoke, bellows, and a heroic attempt at revival could combine into such an unsettling medical habit? And yet, this tale of blowing smoke, quite literally, is just one chapter in human health history's uncanny book. And that's just one of history's creepy medical stories. Want more? Subscribe and dive deeper with Dirty History Doctors. Until next time, stay curious, and maybe a little cautious about history's so-called remedies.